let's change gears here and pivot now to the big story. This might surprise you. It might not. We'll see. In Portland, first responders spend an inordinate amount of time dealing with basically non-emergencies. Things like low-level back pain, stomach pain, and this is a real example thrown out today, itchy toes. People call 911 for these things because they're scared or they don't have insurance or for any number of reasons, really. And emergency crews like fire trucks and ambulances respond because there's no one else. That is until now.
You have to give us a place to live.
In a city where rampant homelessness, gun violence, and other crises have left first responders stretched historically thin.
911?
911 operators will soon have a new option, answering calls for help.
This is a really exciting day.
Portland Fire Chief Sarah Boone there celebrating a green light from the City Council. Commissioners voted Wednesday to launch a new program called CHAT, or Community Health Assess and Treat. This video provided by the city shows how CHAT will work. Instead of sending large teams of firefighters and paramedics, dispatchers will now be able to send pairs of fire medics to low-level health calls. Things like
abdominal stomachache, a minor trauma, a cut. We've had calls for itchy toes.
Yes, people call 911 for those things. And for too long, those calls have kept firefighters and paramedics tied up for hours, something of an emergency bottleneck. The aim of CHAT, officials say, will be to get rid of that bottleneck, treat the patient's health issue, and help them build a long-term health plan, starting with finding a doctor and a way to pay.
Right now, our society and community, people call 911, like I said, because they don't have another option. But we want to show people their option.
CHAT, officials note, will be different from Portland Street Response, the program currently sending paramedics and crisis counselors to mental health and addiction calls. Right now, PSR operates as a pilot program in Southeast Portland. The City Council is poised to take it citywide next year, with a majority of commissioners saying they would vote to fund the expansion. At first, CHAT will run as a pilot program, too, limited to downtown and outer Southeast Portland. The city hopes to launch CHAT in mid-November and plans to pay for it with a $2.4 million grant from CARE Oregon.
Our mission is to inspire and partner to create quality and equity in individual and community health. Right? So we see this as all of that.
So it is important to remember when CHAT launches, again, probably middle of next month, you will get it still by calling 911. You don't have to worry about asking for it. Dispatchers will decide who's best to send your way. That said, we have covered on this show 911 wait times are through the roof right now in Portland. So I asked fire officials if that will impact CHAT, and they said, of course, that's possible, if not likely. So for that reason, down the line, they may consider switching to a different phone number. But for now, they say 911 will have to do.